Mo ti pè yín. Tó bá ń lọ sí ẹ̀. Yé.
tó ń dùn ọ́ tó sì ń dùn ẹ̀yìn náà pé kò tí ì dẹ̀ ni.
Ó ti dẹ̀. Ó fà mí.
Ṣé níwájú?
Lẹ́yìn.
Níbi ẹ̀yìn báyìí. Ẹ̀yìn gan ló máa ń.
Àwọn iwájú mi ò dùn mọ́.
Kò tiẹ̀ fẹ́ tó ẹ̀yìn gan báyìí. Mo ní ìdíkà fẹ́ gbé sáàárín. Ó gbé owó ẹ̀yìn ní kẹ́kẹ́.
Bàbá lè páàkì ẹ̀ sí méjì.
Tí o bá páàkì wọn sí méjì, bóyá ló ṣe rí. Ṣé sùn dùn báyìí?
Àti gbà mọ́lẹ̀. Ṣọ́ra bàbá ń dùn. Orí tébùlù wa. Ṣé ẹ̀kọ́ ti dá? Àlélẹ́yọ̀ kan ní.
Kó má lọ jẹun. Ṣé kò le?
Bismillah, alhamdulillah, wassalatu wassalamu ala rasulullah. Assalamu alaikum wa rahmatullahi wa barakatuh. We welcome you all to another episode of our program. On today's edition, we will be having the topic Breathe is Just Fibroid. So let me start by introducing our lecturer. Our lecturer is no one but Dr. Rahmah Uside Bofo. Apologies for the wrong pronunciation of the name. A distinguished alumna of OAU. Are we together? If you can hear me, please raise your hand. So she's no one but Dr. Rahma to see the Bofo, and I said apologies for the wrong pronunciation of the name if I did not pronounce it right. A distinguished alumna of the OAU and a committed medical practitioner with an unyielding passion for advancing women's health. Throughout her career, she has been a tireless champion for women's well-being, dedicating her skills and expertise to affecting profound positive change on their lives. Our unwavering motivation stems from a deep-rooted desire to empower women, enabling them to assume control over their health and experience enriched, fulfilling life. Lastly, believe that access to comprehensive healthcare is not just a privilege, but an essential and inherent human right. Are we together, please? So please, can Miss Dr. Rahma come on board, please? Dr. Rahma, our lecturer for today, can you please come on board, ma?
Yes, I'm here.
And
Hello,
as we
can you hear
all know,
me?
the topic is breathe, it's just fibroid. Ma.
Hello, can you hear me?
Yes, I can hear you, Dr.
Can you
Rahma.
hear me?
You can come on board now.
Okay,
Yes, I
apology
can.
accepted.
I can hear you
You even
very
tried
well,
actually.
clearly. Okay,
Bismillah, salatu wassalam, ala rasulillah.
okay.
Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Yeah, alhamdulillah. Okay, so I am here to talk about fibroid, to educate us about it. I'm sure some of us are probably wondering why we chose this title for the topic. Like, why are we saying it's just fibroid? Why are we using the word just for fibroid? Being in lab, by the end of this session, we'll be able to understand why we decided to coin the title. So just stay with us till the end, being in lab. Okay, so I'm going to talk about what fibroid is, what causes it, or who are at risk of having fibroid, the symptoms, the treatment options, and then I'm also going to debunk some common myths about fibroid. All right, so what is fibroid? Fibroid is a non-cancerous growth of the womb, and the part of the womb that actually forms the fibroid is the muzzle layer, because the womb has 3 layers. AUI, please, can you share that picture? I actually don't know how to do it. so that I'll be able to explain with it. Hey, you can you hear me? I don't know how to do it. Let me see if I can, so that we'll be able to follow what. Can you see my screen? Okay, so
Yes,
can you
yes, I
see the
can see it.
picture that is showing right now? Okay, thank God.
Yes.
So the womb has 3 layers. There's the innermost layer, there's the middle layer, and there's the outermost layer. So the middle layer is the one that is made up of muscle, and fibroid actually forms from this muscle. So as I said, is a non-cancerous growth, meaning that it is not a cancer. You know, when there's an abnormal growth, it can either be cancerous or non-cancerous. The one that is cancerous is the one that can start moving to different parts of the body, and eventually it may kill the person. But the one that is non-cancerous does not spread. It just stays where it is. That's why we call it non-cancerous. That does not mean that it does not keep growing. It keeps growing, but it does not spread from that site. So I think I've established the fact that fibroid is a non-cancerous growth, and it is from the womb that it starts to grow, from the muscle layer of the womb. The age group where you find fibroid are women of childbearing age. That means women that are within the childbearing category from as early as when that throughout that period where you menstruate is your childbearing age. So from when you start menstruating to when you stop menstruating is your childbearing age. Yeah. But it is commoner in a particular age group, and that is the age after 30. So between 30 and around the time of menopause, fibroid is quite common, and before 30 it is not so common. In Nigerian women, fibroid has been found to be as common as 40%. That means that if you have about 10 women in a room, about 4 may actually have fibroid. So it is that common. So if you have about 100 women in a room, about 40 may actually have fibroid. It's that common in Nigeria. But it's okay, maybe when I get there we'll talk about that. All right, so I want to talk about which group of people are at risk of having fibroid. Like, in what group would you actually find fibroid? Or if you have this characteristic, does it increase your risk of having fibroid? Now let me mention some of those, the common ones. Number one is being black. The fact that we are Africans already increases our risk of having fibroid. People who are non-Africans have a lower chance of having fibroid. And even when they do, they usually have a smaller size. And most times, they may not even have symptoms. Whereas we are more prone to having fibroid and even having the larger size of fibroids. Then family history. If you have a sister or your mom had fibroid, then you are more at risk of having fibroid compared to someone whose family member has never had, there has never been a family member with fibroid. But for a person whose mother or sister has had fibroid, then the chances of having is higher. Another thing is age. I already mentioned that it's commoner after the age of 30. Now, within that age group, it is again commoner if the person has never been pregnant. So people who have never gotten pregnant and they are 30 years and above are at higher risk of having of coming down with this condition. Then people who are obese. When we say obese or overweight, people whose I think we should, how do I describe obesity? Like your weight is more than what is required. So if you are overweight or obese, you have a higher chance of coming down with fibroid. And the reason is because obesity itself, the excess fat releases some kind of hormones. These hormones are implicated in fibroid, and apart from that, it's also implicated in several kinds of conditions like hypertension, like cancers. So it's just best to maintain a good weight. Then a person who lives a sedentary lifestyle, by sedentary lifestyle, I mean somebody who is not working. Fine, you may not necessarily have to go out of your house to work, but you can still do other things that will keep you in shape, like exercise, But somebody who is just like sitting down in one place, sending people on errands, just want to enjoy your life, you're gaining weight unnecessarily, just know that you are fueling a tank for fibroid. Then people who use hormonal agents to prevent pregnancy, like there are some birth control pills that not just pills, whether injections, although the chances are quite slim, but they are capable of contributing to fibroid. Then the person who takes alcohol, alhamdulillah, Islam doesn't allow us to take alcohol. So yeah, that is out of it. But it's just good that we know. So that in case we have whether family members or friends that take alcohol, we can go back and tell them that this is what you are prone yourself to. I don't know. Are we still following? Hope I'm not talking to myself. Assalamu alaikum. Hello.
Wa alaikum salam.
Okay. Alhamdulillah. So I will use this picture to demonstrate the types of fibroid, because the reason why I have to talk about the types is because I have to talk about the symptoms. And if we don't understand the types, it may be difficult following when I'm talking about the symptoms. Okay, so if you look at this picture, you see that there is the one inside the cavity of the womb, there's the one within the muzzle, and there's one outside. So the one within this cavity, the one that you see protruding into the cavity, is the submucosa. I'm talking about this now because I will have to talk about the symptoms later. Then the one within the muzzle layer is the intramural, and the one outside is the subserosa. Now, whether it is submucosa or subserosa, it can be pedunculated. Pedunculated means that it just has like a stalk attached. It's dangling free, kind of. So the fact that it is free can make it to have some certain symptoms, which I'm going to talk about now. Okay, so for the symptoms, it's surprising, but the truth is that most people with fibroid do not have any symptoms at all, like any symptom at all. About 70% of people with fibroid don't have any symptom. So you may not even be able to tell that, oh, this person has fibroid or this person does not. It may just be an incidental finding. Maybe the person came to the hospital for something else, and then the person cannot be told that we found fibroid when we're doing scan or hair. So the person never knew, the person never had any symptoms. So it is good to know that most people with fibroid actually don't have any symptoms, and that is a good thing. Alhamdulillah. So now the symptoms, when people actually have symptoms, the commonest of them is heavy menstruation. Person will tell you that before I got to 30 or before I got to 35, I don't used to have heavy menstrual bleeding. It used to just be normal. I would just see my period for maybe 3 days, and I will use maybe like 6 pads, 2 per day. But now, even when I use like 2 at a time, it's still always too soaked that I have to still change it. Sometimes maybe I can use like 8, I can use like 6. Like the change is usually so drastic. Like it's not just it's not a slight change that can just go unnoticed. Usually a change that they themselves will be like, what's happening? Like it's so heavy. I don't know what's happening. Sometimes, actually most times, they usually have clots within the menstrual blood. Normally, in a normal menstrual blood, there should be no clots. It should just be the flow that comes out normally, like you're just seeing blood and all of that. But when you start seeing clots, clots is like um as if it's congealed blood, like the blood came together to form this kind of round ball kind of hair. You now start finding it on the pad. So instead of the blood just flowing through the that net of the pad going into the foam part, you now have the cloth like dangling above. You are seeing that what's happening. And when you start seeing things like that, it's not normal. So people that have fibroid, usually most times they come down with heavy menstrual bleeding with clots within it. And then depending on how large this fibroid is, they can have distended abdomen. You may see a woman, you'll be thinking that the woman is pregnant, and she's not pregnant because her abdomen is that like distended. A lot of times when you go ahead and do scan for those, in fact, before you even do the scan, people already have the same abdomen from fibroid. By the time you just examine, like if they should come to the hospital, we examine, we already know that there's something there. We are almost 100% sure that this is fibroid. Then by the time you do scan, it just further confirms it that it's fibroid. So it's quite common when you see a woman that has distended abdomen. I'm not talking about people who are obese now. I'm talking about a person who is not really that fat, but the abdomen is like really distended. You're like, is this person pregnant? Is this person not pregnant? You're confused. Most times it could be fibroid, not all the time, but a lot of times. Then I mentioned something that it could be pedunculated. So imagine if this one that is dangling outside, for example, it's so big. The womb is actually not that big. Like the real what's happening? Okay. Come my phone went off. So the womb is actually not that big. I know it looks very big in this picture, but it's really a very small, tiny organ. Imagine somebody having this kind of pedunculated fibroid, right? The womb is very close to the bladder, and that is where the urine stores. It can actually compress on the bladder such that the person starts having frequent urination. Person may end up urinating so many times in the day, even when the person is not taking so much water. And that's because every little urine that gets to the bladder, there's something compressing on the bladder already. So the bladder cannot really take in so much. And the person has to run to the toilet to urinate. So they'll tell you that I've been experiencing frequent urination. The person may not really think of it as as if it could be due to fibroid, but of course it's a problem, right? And nobody wants that kind of thing. Then that same pedunculated fibroid may not just sit on the bladder, it may sit on the intestine. Don't forget that the anus is, everything is all around in the same place. So the rectum leads to the anus, and that is where stool stores. So now imagine if the fibroid is compressing on that rectum, the person will be going to toilet more often. So it could be either way, or the person may even have constipation. So imagine if it's compressing on such that the person cannot, the stool cannot come out. So the person may not start experiencing constipation. They may even have backache if it is resting on the spine at the back. So just depending on where it is, they may have pain within that region, within the pelvis. They may have pain there. Then there's a symptom that can be quite common too that I forgot to mention, and that is painful periods. There is a fibroid now. Apart from the fact that the person can be having heavier periods, the body itself tries to expel anything that it sees as foreign. So the body thinks that there's something foreign here, so let me squeeze it out. So while it's trying to squeeze the normal period out, this time around it's going to squeeze more frequently so that it can expel the fibroid, even if it's not be able to expel the fibroid, and that causes more pain for the person. So the person is experiencing both increased pain and heavier menstruation. Then, depending on the site again, imagine if this pedunculated was around close to the vagina. the person can be having painful sexual intercourse. Now, assuming the person is pregnant, there's something we call degeneration of fibroid in pregnancy. A woman is pregnant, and because the supply to the baby, like the body will try to concentrate the blood supply to the baby. Now the fibroid will not be feeling like the fibroid will be getting more blood supply and be growing bigger. So as the baby is getting big, the fibroid too is getting big. It will get to a point where that blood supply will not be enough for the fibroid, and so it can just, we call it degeneration. So it can degenerate, and as if the cells are dying, and that will cause like a very bad pain that will make them to present early to the hospital. They will think that maybe it's already time for them to give birth, whereas it's not yet time. It could just be as early as, let's say, 22 weeks, 24 weeks. But because of the fibroid, they have to come. So we call that degeneration of fibroid in pregnancy. That can also happen. That can also be a symptom. The person may not have even known that person had fibroid. Then there is one that a lot of people talk about, and that is infertility. Fibroid is not a direct cause of infertility. We are going to talk about that later. But infertility can also be seen as a symptom in certain instances, and we're going to talk about that when we are debunking the myths of fibroid. Okay, so let me talk about the treatment option. In treating fibroid, it depends on the age of the person. So if the person is young, there is a treatment approach. If the person is elder, let me not say elderly, the person is like older, such that the person is close to the period of menopause, like a person who is, let's say, 42 years, 43, you know that this kind of person will soon start menopause. So that kind of person, there's a different treatment approach. So for the person who is younger, you now want to check what's the size of this fibroid. If it's really large, such that it's causing problem, you want to remove it. If it is large enough to cause, discomfort, symptoms, maybe even, discomfort symptoms, you want to remove it. If the person is trying to get pregnant, let's say the person is around 30 something, so the person is trying to get pregnant, the person has been trying to conceive for a while and has not been able to, that kind of individual will need the fibroid to be removed. So the desire for pregnancy is very important in management of fibroid. Then, if the person is elderly and you see that the symptom is not really like significant, maybe the person is not, the symptom could just be that it is big, but it does not cause the person to start having heavy menstrual period, to start, because that period can be so heavy that sometimes they end up on the hospital bed collecting blood. Like, we have to transfuse because the blood is very low. The PCV will be very low, and those kind of individuals, so you have to transfuse them. So you cannot tell that kind of person that don't bother removing it. Of course, you have to remove it. Or if it is small and the person is, let's say, for 3, the person is close to menopause, and during menopause, the fibroid will just shrink by itself. It will just shrink during menopause. So what's the use of removing that kind of fibroid? So that means that the treatment depends on the age of the person, the symptoms that the person presents with, whether the person is desirous of pregnancy or not, then the size of the fibroid. I think I've explained that. So what are the treatment options? The first one I will talk about is watchful waiting. Watchful waiting is like you are watching while you are waiting. Do you understand? So that kind of treatment approach, you are not really going to do anything per se, and you are going to use it for people that are like elderly. I'm talking to you as if I'm talking to a doctor. We use this type for people that are elderly, like people that are maybe like close to their period of menopause, and they are not really having significant symptoms. Or even if the person is young, let's say the person is like, let's say 40, but the fibroid is small, the person is not having any significant symptoms, and the person has probably even finished giving birth, completed family size. So that kind of individual, you don't really need to remove. So just do watchful waiting. it doesn't mean that we will not do anything. We are still going to be maybe doing scan like every 6 months to be sure that it is not getting bigger, and the person may be coming for checkups to be sure that the person still does not have any symptom. When we see that it's not really getting bigger, the person is not coming down with any symptom or any of that, then those kind of people will just not do anything. And in the real sense, that is like the commonest thing that is done for most people with fibroid, because most people actually don't come down with symptoms. Okay, now for the people who come down with symptoms or who are trying to conceive and you have to do something, there are different approaches. There can be the use of drugs. You can use drugs if maybe we know that this person has a very big fibroid. If we should just go in to remove it, the person may bleed so much. So let's give the person drugs to reduce the size such that it becomes small enough to ease removal, and then we do the surgery. That is the other approach. And that surgery, again, there are different approaches. There's the one where it's cut open. I don't think I need to talk about that one so much, but yeah, we do the surgery, we remove the fibroid, and yeah, person is back to being, person is fine. Okay, then I think I should talk about the prevention before I go into, yeah, let me talk about the prevention. So, how do you prevent fibroid? I mentioned some things, like I said, people who are at risk of having fibroid. If a person has a family member with fibroid, if a person is black, if a person has never given birth before, meaning that there are just some things that we can change and there are some things we cannot change. That is it. If you have a mother that has fibroid, there's nothing you can do about that. She's your mother, she's your mother. If she's your sister, she's your sister, and that is it. So there are some things that we cannot do anything about. Your age, you cannot decide to reduce your age by yourself. But there are some things we can do something about. For example, I mentioned that people who live sedentary lifestyle, people who don't, they don't involve themselves in any exercise, and people who are obese, those kind of people, we have to tell them that you should get yourself involved in exercise. Keep a good weight. It's good to maintain a good weight so that you don't increase your chances of coming down with this condition. Eat well, eat fruits and veggies, eat a balanced diet. Then early pregnancy. Pregnancy before the age of 30 is protective for fibroid. And pregnancy after the age of 30, there's an increased chance of coming down with fibroid. Another thing that contributes to that can prevent somebody from coming out with fibroid is actually breastfeeding, because during that period of breastfeeding, at least for the first few months, the person may not even there may not be menstruation at all. So that's already protects the womb kind of from fibroid. So yeah, breastfeeding is also a preventive way. And stop alcohol. Alhamdulillah, we don't take alcohol. But if the person takes alcohol, then the person should stop alcohol. Are we still following? Assalamu alaikum. Am I still here?
Walaikum salam.
Okay. All right. Then I want to talk about the complications. What can happen if a person has fibroid and is not treated? Okay. The first one I'll talk about is the impact during childbirth. Depending on the position of fibroid, it can affect childbirth. Imagine if, I wish I can, I don't know if I touch something, really should to know, Shabi. Imagine if the fibroid is around this, I don't know if I can explain it like that. If it's around the entrance to the womb, that's where the baby is going to come out from. So imagine if the fibroid is around the entrance, it can cause what we call obstructed labor. The person will not be able to push the child out, and it will end up in CS. The baby will not be able to come out because the entrance the baby is supposed to come out through is blocked, and that kind of labor will end up in CS. So that is one of the complications if a person has fibroid and leaves it untreated. Another thing I will talk about is infertility. I was leaving this one for the last, so I'll just talk about it now. Now, a lot of people actually have this misconception that fibroid causes infertility. Maybe they are not absolutely wrong, but I will explain why fibroid may actually contribute to the infertility. Now, if you look at this submucosa, you can see that it distorts the inner lining of the womb. When there is ejaculation, the sperm travels all the way up to go and meet the egg for fertilization to occur. Imagine there's something distorting that inner lining. It will increase the distance that the sperm has to travel through. So even if normally, let's say a particular number of sperms would have been able to reach where the egg is, some will not be able to climb that high because the distance has increased. Imagine something now doubling the distance that is supposed to go through normally. So it's going to reduce the chances of the sperm ever getting to where the egg is. That is one of them. Another thing is, let's even assume that the sperm was able to fertilize the egg. For the ovum that is formed, for it to, and the zygote that is formed rather, for it to implant, it has to implant so that it can stay there and get food and the baby will be able to survive. For it to implant, there's something distorting that place. So it has been able to fertilize it, right? It comes to the point, now let me implant. It's not able to implant. And the reason it's not able to implant is because there is something there that is distorting the cavity. So again, another reason why that woman may not get pregnant. Let's even assume that it was able to implant again. I mentioned something that I said the degeneration of fibroid in pregnancy. If that one should happen, that's another thing that may cause the woman to lose that pregnancy. So it can even lead to recurrent miscarriages. So the woman keeps having miscarriages. So fibroid can also lead to that. Let's assume that the pregnancy did not end up in a miscarriage. The woman may not be able to carry that pregnancy to 36 or 37 weeks, which you expect that this is the right time for a woman to give birth. And the reason again is because the fibroid is getting bigger and bigger and is compressing on the child. So now we have to deliver prematurely. So again, another problem. So it can lead to premature delivery. Okay, let's even assume that the mother was able to get to the time of delivery. I mentioned that if the fibroid is at the entrance, the child may not be able to come out and may end up in CS, which is another problem. So if a fibroid is detected and is not removed, it can actually lead to any of these problems. Then there's the anemia factor again, like a woman who has fibroid and has symptoms and she's bleeding heavily, she's having clots within the blood, she's losing so much blood, like unusual loss. That is not what you expect. So she may even end up start feeling dizzy because of the blood loss. She may end up collecting blood, like may end up doing blood transfusion for that kind of patient. So that is also another factor that can complicate fibroid. But we should not be scared because these are not so common. I already mentioned that the most common is asymptomatic. That means that the woman doesn't even have any symptom at all. That is the most common presentation of fibroid. So we are going to debunk some myths about fibroid. Some believe that fibroids are cancers. At the beginning of this session, I mentioned that fibroids are non-cancerous. So they are not cancers. They cannot migrate, they cannot move to anywhere. They are where they are. They are in that place forever. They are not going to move. Some believe that all fibroids need to be removed. I think we have also talked about that it depends on the age of the patient, whether the patient is young or close to menopause. We also mentioned that it depends on the size of the fibroid, the symptoms the patient has, and whether the patient is desirous of pregnancy or not. Some also believe that it always causes symptoms. Okay, I think we've talked about that too. Then that it can cause infertility, which I also talked about, that it can contribute to infertility. But the fact that somebody has fibroid does not stop the person from being pregnant. However, if you are trying to get pregnant and you have fibroid, you have been trying to conceive and ought to no avail, and you have a fibroid, it is best to remove it because it may be what is contributing to it. But we should not forget that this fibroid can be in different places. Imagine the one that is in the subserosa, like the one in this diagram. It is outside. So that type of fibroid will not in any way disturb a person from getting pregnant. It's only the one within the cavity that can contribute to that infertility. Okay. I think I've gone through what I have for today. And I'll just use this opportunity to say that it is best we go for if we think we have any of these symptoms, it's best to go for regular checkups just to be sure that there's no problem. If you're trying to conceive and you have not been able to, or you're having any of the symptoms I mentioned, you can go to the hospital. They will do a scan. They will examine you first. They'll do a scan. If there is any problem, they're going to let you know. You should not be scared. The highs that can happen with fibroids that you do surgery and you remove it. Most times we just leave it if there is really no problem. Okay. I hope we have been able to convince us and not to confuse us that it is just fibroid. So we should not be scared, right? Thank you for listening. Thank you for having me. The privilege. Jazakumullah khairan. If you have any questions, please go on and ask. Thank you. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you so much for your time. May Allah continue to bless you. Thank you. May Allah increase you in all areas. And I hope we all are together. Please, if you have any question, it's question and answer time actually. So if you have any question to ask her, please go ahead. Raise your hand and ask the question. Please go ahead and ask the question.
Thank you, Dr. Rahmah, for that beautiful lecture. I would like to ask, please, this fibroid, can it reoccur when it's removed surgically? Thank you.
Dr. Rahma.
Okay, I was waiting for all the questions so that I can just answer.
Okay. That's question one. Any other question, please? Please, if you have any question, kindly signify.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Yeah. Please, my question is that the fibroid, are there some measures a person can take to prevent it from manifesting in your body? That's the question I want to ask.
Assalamu alaikum.
Walaikum salam.
Yeah, thanks for the lecture, Jazakumullah khairan. My question is, I heard that eating bread can increase the size of fibroid. Is that true?
What's the question? You didn't get that?
I heard that eating bread can
Bread,
increase
okay.
the size, of fibroids. So is that true?
Any other question, please? And Dr. Rama, please, do you get the question?
Now, I did.
Please, in addition to that, sorry, please, is it, I also heard that fibroid can grow after removing it. So is it no, I'm asking that, is it not better to probably treat it prophetic medicine wise or herbally so that it won't look like they will cut, they will operate and bring it out, and then later on the thing will still grow after passing through the process of operation.
I have a question too. So my question is it possible for fibroid to disappear on its own without any treatment? Did you hear me?
Dr. Rama, you did get the question, please.
Yes, yes, I got it. Okay, so
Another
Please answer
question
the
is,
question.
I'm sorry, please. Another question is the type of fibroid that can disturb conception. If it is not big, like that type of fibroid that is within that place that fertilization will take place. If it is not big, can it still disturb the fertilization process, or the size doesn't matter, either it is big or not. If it is at that point where fertilization will take place, it will disturb it. Thank you. That's all.
okay, assalamualaikum warahmatullahi
Please answer
wabarakatuh.
the question, Dr. Rama. What is sounds like about continue?
Okay, thank you for the question. It shows that we actually paid attention. Okay, the first question was, does fibroid reoccur after removal? Yes, fibroid can reoccur just like every abnormal growth. No, it's not a normal growth. So despite the fact that it has been removed, it's capable of reoccurring at that same place or even at another place. So at a new site or at the previous points of that it was removed from. So yes to that question. Then the next question was preventive measures. Okay, I mentioned some things. I said that I don't know if the person was here when we started. I mentioned the risk factors, people who are at risk of having fibroid. I mentioned the fact that being black, the fact that we are of African descent already increases the chances of coming down with fibroid. The fact that you have a mother or a sister that had fibroid, you are at risk of having fibroid. Your age, so if you're more than 30 years, you're at risk of having fibroid. Doesn't mean that somebody who is less than 30 cannot have. You understand? But the fact that you're more than 30 already increases your risk of having fibroid, especially if you have never had a child. So imagine a 30-year-old woman who has never been pregnant. She's at a higher risk of having fibroid than a person who got pregnant at, let's say, 25. Then being obese increases your chance of having fibroid. Living a sedentary lifestyle, a lifestyle where you're just in one place. You may even be going to work, but your work is not the type that makes you to walk around, just sit down in one place, not that kind of just be gaining weight, that kind of lifestyle can actually make a person to come down with fibroid. And I also mentioned alcohol and the use of some hormonal birth control pills and injections. I mentioned all of that. So I said that if you want to prevent fibroid, you have to prevent those things that are preventable. You cannot prevent your sister from being your sister. You cannot prevent your mother from being your mother. You cannot prevent yourself from being of an African descent. You cannot prevent um your age. Like if you are more than 30, you're more than 30, and that's it. But there are the other things you can prevent, and such are giving birth early. So giving birth before the age of 30, you're already preventing yourself from coming down with fibroid. It doesn't mean that you will not, but at least you are reducing your chances of coming down with fibroid. Being obese can cause fibroid. So why not participate in exercises? Why not even if your job is a type where you have to sit down in one place, maybe after some time you can just walk around, you can do some exercises, some in-house exercises if you like, not taking alcohol, eating a balanced diet, a food that is rich in veggies rather than taking canned foods. Those are just ways of preventing yourself from coming down with obesity or being overweight. So anything that will help you to prevent that will help you to prevent fibroid. Giving birth early will help you to prevent fibroid. Breastfeeding will help you to prevent fibroid. Not taking alcohol will help you to prevent fibroid. See. Then the third question was eating bread can increase the size of fibroid. I don't have any idea. This is my first time of hearing this kind of thing, but it doesn't make any sense because what feeds fibroid, what makes fibroid to become bigger is the hormones. So the fact that you eat bread does not automatically translate to a rise in those hormones. And if it does not, then it does not make sense for your bread to cause the fibroid to grow. Except you're talking about maybe you're taking let's say non-balanced diets, or you're taking a lot of canned foods. Yes, those can increase those hormones and can translate to a rise in the growth of fibroid or even appearance of fibroid, especially if the person already has a risk factor, like maybe family history or something. Then, okay. The next question was, it can grow after removing it. I think that was also the first question, so I've answered that. Then somebody said, can it disappear? Yes, I mentioned that after menopause, the fibroid can shrink on its own. And that is because, during menopause, those hormones that you have during your childbearing years, they just start to decline. So if what is feeding the fibroid is those hormones, is what is feeding the fibroid, they are no longer there. It will just shrink on its own. And that is why when a woman is close to menopause, we don't even bother to remove the fibroid, except it's really, really bad. If not, we are not going to bother because you are close to when it will shrink on its own. Everything, the womb itself is going to shrink on its own when a person is in perimenopause or menopause, during that period of menopause generally. Then the next question was, what did I write? Oh, I don't know what I wrote. Okay, I think the person said that if it is small enough, that does it still contribute to the infertility even if it's within the cavity? The truth is, the larger that fibroid is within the cavity, the one that distorts the cavity, the larger it is, the higher the chances of contributing to infertility. So that means the smaller it is, the lower the chances of contributing to infertility. And I mentioned that the fact that somebody has it doesn't mean that person is going to be infertile. So it depends on quite a number of factors. It's possible that it's even large, but the after fertilization, the zygote did not come to that place that has the fibroid to come and implant. It can go to another side. There are so many sites it can implant. So it's just coincidental that it went to that place and it got and there was a problem. If it were to go to another site that did not have any fibroid, then implantation will not be affected in any way, and the person will still end up having the baby, despite the fact that it just depends on a lot of factors. Coda, put it that way, because I cannot tell what made it to go to that site that had the fibroid in the first place. Okay, I think I've answered the questions. Assalamu alaikum.
Walaikum salam. Jazakallah khairan.
Please, Mad, Oyemi Dada, do you now mean that if it is more, it will not disturb the fertilization process?
So should I just go ahead and answer? Assalamu alaikum. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
Okay. She asked if it's small, will it not distort? It can. But I'm just saying that the larger it is, the higher the chances of it disturbing the fertility. So if it is small, even if it can, the chances are quite slim. Not that it cannot, it can, but chances are quite slim compared to a larger one. That's what I'm saying. I don't know if you get me now.
Well understood. Jazakallah khairan.
I mean,
Assalamu alaikum. Please, you mentioned the foods that I think maybe few foods that can cause diabetes. Sorry, fibroid. Please, what about snacks, as in cakes and the likes? Is it constant eating of such, or what can it cause? Is it a factor? Assalamu alaikum. Please, do you hear my question?
Walaikum salam. Sorry, I think the network was stable.
Okay. I said, what about constant eating of snacks? Does it have any effect? Like, can it cause fibroid? Cakes and the likes.
Okay, so you said constant eating, so the person takes it a lot. It can contribute to the overweight or obesity that we already talked about. Taking foods that processed foods, canned foods, foods that are rich in fat, like the snacks and all that. It doesn't mean you should not take snacks, but when you take something too much, it can contribute to the person becoming overweight, can contribute to the person becoming obese. And when that happens, it is the fat itself that releases hormones that contribute to the formation of those fibroids within the womb. I don't know if you get me. So it's not really the food itself that just directly causes the fibroid. No, it causes something that causes the fibroid. And what it causes is that it causes the accumulation of fat. So the person may end up being overweight or being obese, and that increases the person's chances of coming down with fibroid. Especially for us that are Africans, that we're already at risk. Every black person is already at a higher chance of coming down with fibroid. The fact that we are black. So now taking something that would further contribute to it just increases the chance. So if you look at it,
Jazakallah khairan. Yeah. Thank you very much.
I mean,
Do you still have? Do we still have anybody that wants to ask question? Do we still have anyone that wants to ask question? Okay, if no, so we have come to the end of today's episode. Thank you all for listening. God bless us, and thanks so much, our doctor, our lecturer for today. May Allah continue to increase in knowledge, wisdom, and understanding. Bye.
Amin. Assalamu alaikum warahmatullahi wabarakatuh.
Jazakumullahu khairan.
Alaikum salam.